This week on Being Well, Jamie Forsythe from the Pediatric Department of Carle Foundation Physicians in Mattoon will be here to talk about well baby and child checkups. Jamie is a nurse practitioner who will provide us with lots of good information on child development, common childhood illnesses, and more. That's next on Being Well, so stay right here. Well, Jamie, thank you so much for coming on Being Well. We've got a lot of stuff to cover today. Let's talk first about your job. You're an advanced practice nurse. Tell us a little bit about the schooling that's involved to become an APN.
Sure. An APN is Advanced Practice Nurse, which means that you have advanced your education beyond being a registered nurse. After getting my bachelor's degree in nursing, I went on and got a master's degree in nursing, and I specifically specialized in pediatric nurse practitioner. So there are lots of different degrees nurses can get being an advanced practice nurse. Variations of nurse practitioner or nurse anesthetist, where they work in anesthesiology, or a nurse educator. So there's lots of different things that you can do.
So what's the difference between an APN and a physician's assistant?
An APN, again, is nurse-based, so you have to have had a nursing education to go on. A physician's assistant has a degree specifically being an assistant to a physician, and they just got a different degree. Often they're educated under more of a medical model versus a nursing model.
Okay, so let's talk about what are some of the procedures and medical things that you do as an APN?
My job specifically is in outpatient ambulatory care clinic, where I do well visits, I prescribe medications, I often take care of wounds if there's suturing, something like that. Primarily outpatient procedures, labs, things like that.
So are there things then that you don't do that the doctor comes in and takes over and does?
Not very often in our office. There may be something, lumbar punctures, something that's a little more serious that we often can do in the office, but we may send them out to the hospital or somewhere else to do.
Okay, so are APNs and PAs, or physician's assistants, they are called mid-level providers?
Correct.
Okay, so why is it that it's easier to get in to see the mid-level providers than the doctors? Now, we don't want to, discount our medical doctors. We need them too, but why is it easier to see?
That's a good question, and we get that question a lot. It's just difficult to recruit physicians. As we know, we live in a rural area, so it's difficult to recruit physicians to rural areas, and we just aren't turning out physicians as fast as we would like to. We have aging populations, we have a large demand of need for medical providers in general, so healthcare systems have then tried to fill in that need with mid-levels as physician's assistants and nurse practitioners. So what we're trying to do is then let patients know that we are a team, that you need to look at your physician and your mid-level as a team. And if we can educate our patients into seeing the mid-levels when it's for these healthy routine checks, these maintenance health visits, then that will free up the physicians for those times when you're really sick and you need that acute emergent visit.
Okay, so for someone like me, I'm 43, I'm fairly healthy. Do I have an APN? Do I need a regular doctor too?
She probably works, or he probably works with a physician, and it's wonderful if you establish and you're healthy, well, and there's not any serious problems, to see a mid-level. That is great, and that's what we like to encourage. Now, people that have chronic health issues, more serious things, it is good for them to be established with a physician so that those issues can be dealt with probably by a physician.
Okay, so let's talk about your role. You're actually in the pediatrics area at Carle. So what does your practice specialize in?
So my license allows me to see patients from zero, from day one until they're 21, actually. So I do, again, outpatient visits, healthy, well babies, sick visits, sore throats, lots of sore throats and ear infections, a lot of that kind of stuff. So every day, children visits is what I do primarily.
Okay. So let's get into that. We have a lot of moms watching. Let's talk about the care plan from, like, say, birth to age 3. What are the typical things that you're testing and what are you looking for?
So we like to establish a schedule for when we can see them. So we usually see them newborn, your first few days out of the hospital, and then we kind of do that a week weight check. We want to make sure they're eating well, doing all those things monthly, every couple of months. We start establishing this pattern, and we have a schedule that we let them know what that will be, what the expectations, things we want to look for, risk factors. What are their risk factors? So exposures to lead, what kinds of places they live in, their environment, who else lives in that environment, what are they eating, where are they sleeping, all these different things. We're looking at their risk factors, making sure they're meeting their milestones, and making sure they're developing in a normal, healthy way.
So what are some of the key milestones that you look for at different points, ages?
Okay. We actually use one of the common milestones. Denver produces a screener for milestones that we use at every well baby visit. And so the areas that those cover are motor areas, gross motor, fine motor. We're going to look at psychosocial, how they're developing in that area, and of course language. We want to make sure that they're meeting all those areas. So depending on their age, are they making eye contact? Are they smiling at you yet? Are they using their hands to feed themselves? Depending on what age they're at, we want to make sure that they're meeting those milestones.
Okay. So is that sometimes, we hear a lot about autism and when kids don't meet those milestones, is that, at what point do you start maybe seeing some of those signs that maybe there might be something wrong?
We see a lot of that, and that's a very big concern for a lot of parents because it's such a hot topic right now. So we can see maybe those issues early on, but the most common age we look at is around the first year. Are they making eye contact with you? Are they verbal? Different things. And then again through 3 years old, like we said. At 3, we're still again looking at the way they talk. Are they making eye contact? Are they interacting with you? So those are 2 probably prime areas. There are screeners that we use specifically for autism at the 15-month and 36-month age group. Okay.
So I know you see a lot of new parents, new moms. What are some common things that cause a lot of panic that you could address that you get moms, like, oh no?
Oh, yes. It's normal. New mommies have lots of new mommy guilt and things to worry about. The biggest worry is probably what's going in and what's coming out. Is enough going in, and is the right thing coming out, is the right amount? And really, at any age, that's always the concern. And what we look at as medical providers is the right things going in and are the right things coming out. So that's probably the number one concern right there at the first couple months of lives for mommies. And so, and I actually just had this today, and so I just try and explain to them if they look happy, they're having diapers, and they're growing, and they're smiling, and try not to worry about it.
Okay. So what do you do for moms? Maybe two friends had babies at about the same time, and one's advancing. Not every baby advances exactly the same. At what point do you go, don't worry about it?
Every visit I tell mommies that. And since I have my own child, I try and put myself in their place and try and relate stories with them a lot and say, every grandmother, every friend, every mother is going to tell you how to do things and compare things. Do what works for you.
Okay.
That's what you have to do, is do what works for you, and every child is different, every person's different. But to try and relax and only do what works for you.
Yes. So when do you need to call your medical provider? For instance, when is a fever too high, or maybe a cough sounds a little not right? What are some warning signs and some things that, you need to look out for?
It definitely depends on age with fever. In the first few months of life, any fever is of concern, and we definitely want you to contact your provider. We usually kind of use the standard of 100.5.
Okay.
We really consider that a fever. Fever that doesn't respond to any kind of fever reducer medications or any interventions, fever lasting more than 3 days, that's definitely a concern. But if we're talking about a new baby, we always want mommies to contact us, or parents in general to contact us, because we want to figure out what's going on with that baby.
Okay. What about vomiting?
Vomiting
Vomiting and diarrhea. We'll put those two together.
Oh yes, and we've seen a lot of that this year. That's definitely been going around and around and around. We try and actually take care of that at home if we can, because as you know, bringing that into the office only spreads that to others. So if it's vomiting and diarrhea combination, if they're not able to keep anything down, that's something definitely we need to know about.
Like keep anything down for how long? More than a day? More than half a day?
Well,
or
we like to go by the rule too, if they're urinating within 6 hours.
okay.
So that's a good sign if their mouth is moist. If they're a baby and they're still able to make tears, those are all good signs that they're still well hydrated.
Okay.
But if they're not holding anything down in even half a day, we probably need to see them.
Okay. Let's get into some seasonal diseases. You know, we've got colds and flu and RSV and all that sort of stuff. What are the ones that are really, for like infants, can be really critical if an infant gets something like that?
RSV is definitely
Okay,
one of
and
those.
explain what that is.
It is a virus, and so of course you have this very sick baby, and parents want you to give them something to make it go away and make it better. But RSV is a virus. It's a respiratory virus that will affect infants. It may be like a cold for you or I, or one of the older siblings in the family, but in an infant it can be very serious. So fever, cough, congestion, those are all kind of the symptoms that we see. But if it continues to progress, we start seeing signs of respiratory illness that is not getting better, definitely need to see babies.
Okay, so an RSV, it's a virus, so you can't give an antibiotic for that.
Correct.
What is the treatment for it then?
It depends. A lot of times it's just symptomatic treatment, suctioning their nose, making sure that they're eating, drinking. If it gets worse, sometimes it may need steroids, breathing treatments, even oxygen hospitalization.
Is that something that only infants get up to a certain point, or can toddlers get RSV as well?
Toddlers can get RSV, but it is usually much more serious in the younger child. It's much more like a bad cold for a toddler.
Well, let's talk about, I'm sure there's many moms out there who have had children with the croup.
Oh,
What
yes.
is the croup? We all know what it sounds like. Sounds horrible, but what?
Sounds like that barking seal. So that's that classic sign that we talk about with parents. Croup is also a virus.
Okay.
And it is very seasonal. As we see changes in the weather, like we've been having the spring come on, we often see it. The best thing for croup when your child starts that barky, croupy cough is cool, moist air. The opposite of everything we think of when our child is sick.
Yeah, don't you think of sitting in the shower?
Warm
Yeah,
heat.
warm heat, so cool,
The
moist.
exact opposite. So we want to bundle them up and take them outside, cool, moist air.
Okay.
So even if it's nighttime and that cough gets really bad, take them out on the front porch. I even say open the freezer door, let them breathe in the cool, moist air.
Really? Yeah, because you do. In movies, you see the mom in the shower with the, okay, that's good to know. What other kinds of, let's talk about allergies. When do allergies start to develop in kids?
Well, small infants can have allergies to foods, and they may have allergies to other things. We do not do allergy testing until the age of 2.
Okay.
That's when they can do skin testing. To say there is lots of controversy over what age children actually develop allergies, they do not do skin testing, is what I can say, until the age of 2. Now, some families have strong seasonal allergies. You may see that in younger children. And we live in the Midwest, so we get exposed to all kinds of dust and corn allergens and weed allergens and tree allergens. And so we may see that at any time with small children.
Okay, well, what about like allergies to milk or breast milk. How do you kind of know if, your child's having some problems with that?
That is one of those concerns, one of those panicky hot topics with new moms. And there's a lot of controversy over this, but milk allergy is a milk protein allergy is what it's called. And it is possible in infants. We see that if they're having blood in their stools, if they're having a lot of spitting up or vomiting when they're eating their formula, if they're on a milk-based protein formula. In that case, then we often switch them to one of the other formulas.
Something soy-based or something like that.
Or there are some allergen formulas.
Okay. We did have a viewer question, and she asked, can kids be lactose intolerant like adults?
They can.
Okay.
They can. And it kind of varies on the age, but lactose intolerance and milk allergies are different, and so a lot of people are different. So you can have a milk allergy, but it's not the same as being lactose intolerant. Lactose intolerant just means you have a hard time breaking down the milk sugar, and so it is possible that some children can have that. It's and then in that case, you can do more soy milk and things like that.
So what would be some of the symptoms if you think your child might be lactose intolerant?
A lot of times it's a lot of stomach aches, diarrhea after having any kinds of dairy.
Okay.
Specifically milk or ice cream, things like that.
Are there other kinds of seasonal diseases that you see going around? Or other things that seem to be, maybe if your child goes to a daycare, that really go around really quick that you wanted to address?
Well, always at the beginning of the school year, once everyone's in close quarters again, we start seeing the rise of strep cases. We start seeing the rise of any communicable illnesses, head lice, unfortunately, things like that. But it kind of depends on how close quarters they are. So we always see that shift when school starts again or when winter comes because we're inside and closer even or wearing coats and things. So those are the things that we see changes with the weather.
Okay, well, we've kind of focused our attention more on infants and small children. What about as your kids get older? How often should they be going for a checkup once a year before school, or what's recommended?
We do like to see them once a year. We do recommend that. I know that as our kids kind of get out of the phase of doing well babies, we have seen the doctor's office so much that we're thinking, my gosh, I don't want to. Yes, I'm tired of these appointments. But we do recommend once a year. We try and get our patients on a schedule of coming every year on their birthday. Because if we can do that, then we avoid that large crunch at the beginning of the school year or over the summer when everyone's doing school physicals, sports physicals. So we like to make it a habit if everyone just gets in the routine of doing them on their birthday annually.
Okay. Are there certain things that you're seeing more of in like our, preteen and teen kids? That come up?
There are a lot more stressors on our children, issues of bullying, things like that. Texting, we see a lot more, it sounds crazy, headaches, and I have found a lot of it is how much screen time. And when I say screen time, they assume I'm talking about
in the computer.
Or the TV. And I have to quickly clue them in that also includes that cell phone. So a lot of headaches, vision problems, things like that. But I think a lot of headaches, tension, also a lot more fatigue. Children are trying to do too many activities. Our teens are in several activities and doing probably a lot. So sleep deprivation, which is normal for teenagers.
One of the things I thought of, and I don't know if you want to address this, is the shot that you can get for teenagers for sexually transmitted disease, the one that causes,
cervical cancer?
Cervical cancer,
the HPV
yes.
vaccine.
The HPV, which is human
papillomavirus.
Yes, thank you.
That's okay. It's a mouthful.
Okay, is that something that you talk to parents about, or is that, what are your recommendations?
I do talk to parents about that, and it's included in all of my well visits as optional vaccine. It is optional. It is a vaccine that we do have to help prevent cancer, cervical cancer. It is now recommended for adolescent boys, not only girls. I do recommend it. I believe that any immunization that we have that prevents a type of cancer, I think it's great. I know that there are lots of concerns. Parents feel it's still very new. I would like to educate them on that it takes an average of 17 years for a vaccine to come to market for them to test it. So it's not really so new by the time you hear about it. I think that a lot of parents have concerns that if we're giving this vaccine that we're encouraging them to have sex. And I try and explain to them it has nothing to do with that. It has everything to do with protecting their body.
Okay.
Because it might not always be about an optional sexual encounter. So you're protecting them in any way.
So what's the recommended age? Is it the same for girls and boys?
It is.
Okay.
Adolescents, we usually try and address it at the 6th grade physical, and again, I usually try and address it at the freshman physical.
Okay. We've got just a few minutes left. I just want you to kind of give our parents out there some advice to keep our kids healthy. Maybe a way to get our kids sort of exposed to some of the good germs. We kind of live in a society where everyone, has hand sanitizer and maybe over sanitizes. And when you and I were kids, we didn't have that.
Hand sanitizer, what was that?
What was that?
A little more dirt.
To kind of build up our immunities and keep our kids healthy.
Hand washing is very good, and we do want to encourage that, but restricting kids from being in daycare or doing these things or not going to stores or being in the public, that's not going to prevent them from developing these illnesses. So still having normal interactions, still being around play groups is good, healthy for their psychosocial and for their good germ exposure. But teaching them to wash their hands is important.
Yes, we've had several hand washing conversations on this show when it deals with flu and that sort of stuff. So good hand washing, and then also regular medical checkups.
Regular medical checkups and routine immunizations.
Okay, which is a whole other subject we don't have time to get in. Jamie, thank you so much for coming on Being Well. We appreciate the great information, and we'll hope to have you back again.
Thank you.
Teenagers, one of the last things on their mind is a diagnosis of cancer, especially if it's a type of cancer that adults usually get. But the teen you're about to meet has a gene that greatly increases her risk of colon cancer. It runs in her family, and many of her relatives have battled the disease. So did she. Vivian Williams has the story of one family's journey with what's called Lynch Syndrome.
My mom and I are very close.
So whenever they can, Emily Ruby and her mom Karen Sansom hit the local shops to enjoy a hobby they've shared for years.
We'll shop a lot together, and it's one of our favorite activities.
They also share something else, a gene that runs in their family that dramatically increases their risk of developing colon and some other types of cancer.
I knew that there was a history of colon cancer in our family.
On Karen's father's side,
We could trace it back to his mother, his sister, his grandmother.
Karen is also a survivor, and so is 24-year-old Emily, who was diagnosed with colon cancer at age 19.
It kind of aged me quickly almost.
At some level, I was prepared for it maybe later in her life, but at the age of 19, it was completely devastating.
The condition is called Hereditary Nonpolyposis Colorectal Cancer, or Lynch Syndrome.
It's a form of hereditary colorectal cancer, and it runs in families, and they're at risk not only of colon cancer, but a variety of other cancers.
Dr. Amy Oxentenko says if you have Lynch syndrome, there's a 50-50 chance you'll pass it on to your children. Genetic testing can verify if you're a carrier.
If you find out you have it based on your family history or any kind of testing, you need to begin a very vigorous screening and surveillance program.
The program includes colonoscopies starting at age 20 or younger, depending on your family history, upper endoscopies to check for stomach and small bowel cancers, plus early and regular screening for gynecologic and kidney cancer. The goal is to catch precancerous or cancerous lesions early while they're still curable.
The most important thing to do is educate yourself, first of all.
Emily and Karen are both doing very well. In fact, the visit to this flower shop marks a very special anniversary. It's been 5 years since Emily's diagnosis, and she is now cancer-free.
It's a big day to celebrate. I'm very happy about it.
For Mayo Clinic News Network, I'm Vivian Williams.
Finally, we take a look at a test that can help a woman get a glimpse into the future of her fertility. Susan Hendricks has more.
After getting married, a simple blood test would have told Amy and Tim Hoffman not to wait too long before starting a family.
We definitely always thought that we'd be parents.
Although she was in her early 30s, Amy didn't have many reproductive eggs left, a discovery her doctor made after giving Amy an AMH test. It's a blood test that can determine roughly how many eggs a woman has at any point in time. It's not expensive, but it's so new, your doctor may not even know about it.
This actually can tell you on a score of less than 0.1, which is the lowest number, up to 4 or greater, how many eggs you might have left as your ovarian reserve.
You may not know that a woman's eggs may not necessarily age in tandem with her body. That means it's possible for a female in her mid-30s to have the eggs and thus the fertility chances of a woman much older.
Many of these ladies actually have lower ovarian reserve, or the number of eggs left, than we ever had anticipated. We're not sure why, but we're trying to get more of the young women to at least get that test done so they would know where they stand.
Amy went through in vitro fertilization and became pregnant. Women without a partner can still get an AMH test and freeze their eggs if the test comes back low. For today's Health Minute, I'm Susan Hendricks.
Thanks for watching this episode of Being Well. Join us online anytime at youtube.com/WEIUTV. Here you can view current as well as past episodes.